Good afternoon, and welcome to today's webcast from the Agency for Healthcare Research and Quality on the surveys on patient safety culture for new users. My name is Naomi Yount with Westat, the contractor that supports AHRQ's SOPS surveys, and I'll be your moderator today. Next slide. Okay, a few housekeeping tips. If you have any issues with your computer audio, you can connect using your phone by selecting the Call Me option to enter your phone number, and you'll receive a call from Zoom. Or click on Phone Call to find the dial-in number and meeting ID. If your computer freezes during the presentation, you can try logging out and logging back in. If at any point in today's webcast you want to ask a question, please do so through the Q&A icon, and speakers will respond to your questions during the Q&A segment at the end of today's webcast. Please note that we have disabled the raise hand and chat features. You can download the presentation slides and view the agenda and speaker bios on our event website, which is https://events.westat.com/SOPS. In addition, a replay of today's webcast and slides will be made available on the AHRQ website soon. If you have to leave at any time, you can rejoin using the same link you used to join right now. Next slide. I'm happy to introduce our speakers. We're very pleased to welcome Jonathan Bakdash, who is a social science analyst for the Surveys on Patient Safety Culture, or SOPS, program at AHRQ, and Rose Tyler, who is a lead research associate at Westat and the SOPS database manager. Again, I'm Naomi Yount, and I'll be moderating the webcast today. Next slide. Our agenda today starts with John Bakdash giving a brief overview of the AHRQ SOPS program. Then Rose Tyler will discuss the SOPS surveys, what they are, why you should use them, and the benefits of participating in the SOPS databases. She'll also describe some free resources available to SOPS users. And finally, we'll end with question and answers. So let's begin. And with that, I'll hand it off to John. Next slide.
Thank you so much, Naomi. Hi, my name is John Bakdash. I work for the Agency for Healthcare Research and Quality, AHRQ. I'd like to welcome you today. I'm going to provide a brief background about AHRQ and tell you a little bit about the Surveys on Patient Safety Culture SOPS program. Next slide, please. AHRQ, the Agency for Healthcare Research and Quality, is a science-based agency that's part of Health and Human Services. AHRQ is the lead agency charged with improving the safety and quality of the U.S. healthcare system. As a research agency, we are not a regulator. AHRQ does not require the use of our tools or products or to submit data. If there are any requirements to use a SOPS survey or other AHRQ product, those requirements come from another organization or agency, not from AHRQ itself. Next slide, please. I also want to emphasize for any data that gets submitted to an AHRQ database, we can encourage voluntary submission. We do not require submission of the data. And we have a very strong confidentiality statute in place that limits the use and access of the data and protects all the identifying information. This is similar to a certificate of confidentiality in the research world. Next slide, please. So now to give you an overview of the AHRQ SOPS program. It has been around since 2001, and it aims to understand, measure, and improve patient safety culture in various healthcare settings. The SOPS program has developed several different validated surveys and measures. And again, like I mentioned earlier, voluntary submission of the SOPS databases. And another component of the SOPS program is conducting research to better understand and improve patient safety culture, and also resources for improving patient safety culture in facilities. I also want to mention that SOPS surveys are trademarked, which ensures that the brand is valid and reliable. Next slide, please. What is patient safety culture? I'm going to give you the AHRQ definition. It's defined as a set of beliefs, values, and norms that are shared by healthcare providers and staff in an organization. So these are behaviors that are rewarded, supported, accepted, and expected as they pertain to patient safety. And this exists at multiple levels, from the person at the front desk to the hospital leadership. And good safety culture should permeate throughout the organization. Next slide, please. Now I'd like to hand it off to Rose Tyler, who's going to go over this in more detail. Thank you.
Thank you, John. My name is Rose Tyler, and I'll be discussing the SOPS surveys, the databases, and resources, which can all be found at www.ahrq.gov/SOPS. Next slide, please. AHRQ surveys on patient safety culture assess provider and staff perceptions of patient safety culture in hospitals, medical offices, ambulatory surgery centers, nursing homes, and community pharmacies. AHRQ supports databases for each of these survey settings where organizations may voluntarily submit their survey data. Next slide. Here are some of the areas of patient safety culture that are assessed across the core SOPS surveys. We have communication openness, response to error, staffing and work pace, teamwork, and more. Next slide. In addition to the core SOPS surveys, AHRQ has developed supplemental items that assess additional areas of patient safety culture. There are supplemental items that assess workplace safety for providers and staff in hospitals and nursing homes, including questions on burnout and turnover intentions. We are also currently developing workplace safety items for medical offices. Our other supplemental items assess value, efficiency, and waste reduction, health information technology, and diagnostic safety. Next slide, please. All SOPS surveys are composed of a core set of standardized questions that support the comparability of survey content across users. The core survey must be administered in its entirety without modifications to the survey order, survey item, or response options. To assess additional areas not included in the core surveys, you can add optional SOPS supplemental items and/or custom survey items. You can add these at the end of the core survey, just before the background questions. You can add all the SOPS supplemental items or selected sections. For example, rather than including all the SOPS workplace safety items, you can administer just the questions on addressing workplace aggression from patients or visitors. Specific instructions for how to add supplemental and custom items can be found on the AHRQ SOPS website and are on the cover pages for the SOPS supplemental items. Next slide, please. Now that we've spoken about the SOPS surveys, you may be wondering, why should your organization use these surveys? Next slide. Well, I'll give you 6 reasons. 1, they were developed with extensive input from experts and healthcare professionals to make sure they ask about the most important aspects of patient safety culture. 2, they were comprehensively tested, so they are valid and reliable measures for assessing patient safety culture. 3, they are linked to important quality and safety outcomes like better patient experience and lower surgical site infections, readmission rates, and adverse events. 4, they are widely used by healthcare organizations in the US and internationally, with benchmarks available through the SOPS databases. 5, they are actionable, so you can use the SOPS surveys to identify areas of strength and for improvement. 6, the surveys are free to use, and AHRQ provides free technical assistance and resources. Next slide, please. Here we have our survey development process. First, we conduct a review of the literature and look for existing surveys. We then identify a technical expert panel or a TEP. We interview experts as well as healthcare providers and staff for the setting. And using all this information, we identify key areas of safety culture to assess and develop draft survey items. We cognitively test the items and iteratively revise them based on the cognitive testing results. We obtained input from the TEP on the items before conducting a pilot study. We then conduct psychometric analysis to examine the reliability and constructability of the survey measures, and again, consult with the TEP before finalizing the survey. Next slide. There have been a number of analytics studies linking SOPS hospital survey data to other outcomes. Higher SOPS hospital scores have been linked to lower rates of surgical site infections, lower readmission rates, better financial performance, lower adverse events, higher hospital CAP scores, and higher Consumer Reports hospital safety scores. Next slide. SOPS hospital workplace safety is also associated with patient safety culture, where more positive perceptions of workplace safety were associated with more positive perceptions of patient safety culture. Higher work stress burnout was also strongly associated with more negative perceptions of patient safety culture. Next slide. Additionally, research studies have found higher SOPS nursing home scores have been linked to lower turnover rates, lower use of physical restraints, fewer falls, and higher CMS 5-star quality ratings. Next slide. The SOPS surveys can be used to assess the current status of patient safety culture, raise staff awareness about patient safety, identify strengths and areas for improvement, examine trends in patient safety culture over time, and evaluate the impact of patient safety initiatives and interventions. Next slide. SOPS may also be used to meet various requirements. Leapfrog option 1 requires the use of unaltered, nationally recognized tools with information on the validity, consistency, and reliability of the tool. The SOPS Hospital Survey versions 1.0 and 2.0 may be used for this requirement, but only 2.0 may be used starting in 2026. The CMS Hospital Inpatient Quality Reporting Program Patient Safety Structural Measures will require hospitals to conduct a culture of safety survey annually or every 2 years with pulse surveys starting calendar year 2025, which can be fulfilled using the SOPS Hospital Survey. And because the SOPS surveys are valid and reliable, they may be used to meet the Joint Commission leadership standards for leaders to regularly evaluate the culture of safety and quality. Next slide. As mentioned earlier, Westat supports databases for each of the SOPS surveys where users may voluntarily submit their survey data. Given that submission is voluntary, why should your organization submit to the SOPS databases? Next slide. Well, participating organizations receive a free feedback report for each facility that submitted data. The feedback reports compare their results to the latest database results and can help to identify strengths and areas for patient safety culture improvement. The feedback report will also present data by different respondent characteristics, such as staff position, work area, tenure, and more where applicable. Next slide. Second, database reports are created to provide overall aggregated results and benchmarks by facility and respondent characteristics, such as bed size, ownership, region, unit work area, tenure, and interaction with patients. And this report provides a snapshot of patient safety culture and what areas across facilities may need to be addressed. Our 2024 hospital database report included 445 hospitals and over 280,000 respondents. Next slide. We will have the Ambulatory Surgery Center database open in June and the Medical Office database in September. During this time, we will accept data for the core surveys and their supplemental items. If you are planning to submit to the databases, we recommend submitting your survey for review prior to administering it or even before the database opens. And this will help prevent any issues with your survey, which may make your organization ineligible to participate. Next slide. Now I'll talk about the SOPS resources. Next slide. Now that you know a bit more about our surveys and what they cover, I wanted to share our survey user's guide. We have a server user's guide for each SOPS survey, and we recommend reviewing these as your first step of using the SOPS surveys because they provide a lot of useful information, such as getting started, selecting a sample, administering a web-based and/or paper survey, and analyzing the data. Next slide. And after you've administered the survey and analyzed your SOPS results, you can then use our action planning tool. The action planning tool is designed for all survey settings and provides a step-by-step guidance to help survey users develop an action plan to improve patient safety culture. This tool can be used to identify your patient safety culture areas for improvement, plan your improvement initiatives, and how to communicate your plan. Next slide. And as you're working through these action plans and identifying areas for improvement, you might also find our Improving Patient Safety resource list useful. We have resources for each survey setting and all the supplemental items. And these documents contain links to practical resources that are free and publicly available to help improve patient safety culture and patient safety in your organization. Next slide. There is also a SOPS bibliography with the purpose of providing citations for articles published on the AHRQ SOPS surveys. It includes references on the use of the surveys, psychometric analyses, how to improve patient safety culture, analyses linking the survey to outcome data, and more. And our references go as far back as 2005. Next slide. AHRQ also routinely sponsors webcasts such as this one to provide information about SOPS products and related resources, offer updates on the status of products in development, and provide support in using the SOPS surveys and data. Previous webcast materials are available online. Next slide. We offer free technical advice or TA to SOPS survey users. Our general TA help desk can be reached at 1-888-324-9749 or via email at safetyculturesurveys@westat.com. They can help you with questions about survey administration, such as making sure your survey aligns with the SOPS trademark, and connect you with any of the survey materials or supporting resources. International users can also request permission to use any of the SOPS surveys in their respective countries. Our database TA help desk can be reached at 1-888-324-9790 or databases on safetyculture@westat.com. And they can assist with submitting to the various SOPS databases, answer questions about the database reports, and respond to special analytic requests for data included in the SOPS databases. We are happy to help, so please don't hesitate to reach out. Thank you, and next slide.
Thanks so much, John and Rose. That was a lot of information in a short amount of time. So I see there's a couple questions that have come in. So we're going to turn to Q&A. And I'm sure you guys will be happy to field some questions. Next slide. As a reminder, you can ask questions to the Q&A feature. Look for the Q&A icon. We encourage you to share your name and role when you type your question. If you join late, a replay of today's webcast will be made available on the AHRQ SOPS website. So let's go ahead and get started with some questions. I see one of the initial questions that came in. I'm just going to go ahead and handle. How does the SOPS hospital survey meet the requirements for CMS's patient safety structural measures? As Rose mentioned, the SOPS survey, the hospital survey, can be used to meet Domain 3 of the CMS Hospital Inpatient Quality Reporting Program. And this is very long, patient safety structural measures. And that requires hospitals to conduct a hospital-wide survey of safety survey annually or every 2 years, with pulse surveys on the other. If you do it every 2 years, you do pulse surveys starting calendar year 2025. The AHRQ SOPS program is currently preparing guidance on what a shorter pulse survey of the hospital survey would look like. And so stay tuned for that. And a follow-up question I think might be related to that from Amgad Khalil. Are there any changes to the format or questions included in the SOPS Hospital Survey 2.0 in 2025? And I'll answer that real quick too. No, there's no changes to the 2.0 version that we have prepared, but as I just mentioned, AHRQ is working on guidance on how to administer a pulse survey to meet those patient safety structural measure requirements. Okay, this next one is for you, Rose. And I apologize if I don't have this name 100% right. Ala Edin Obied. I've noticed there is a trend where organizations tend to use shorter safety surveys, maybe only 5 questions. They mentioned that if they use long surveys, no one's going to complete them. Can you respond to that?
Yeah, sure. So the SOPS Hospital survey is one of the most widely used SOPS surveys. The 2.0 survey has 34 survey items, and the average response rate among hospitals that submit to the hospital database is 52%. So longer surveys can absolutely get good response rates. Shorter surveys can provide an overall assessment of patient safety culture, but do not provide a lot of the information that is helpful to identify those areas for improvement. That is why the SOPS surveys include composite measures consisting of 2 or more survey items, which are reliable measures that can be used by healthcare organizations to identify their strengths and areas for patient safety culture improvement.
That is a really good point. Thank you, Rose. This next question is for you too. Who fills out the survey and how do we improve based on the survey results?
Sure. Each SOPS survey has a user's guide that provides helpful tips on whom to survey and how to administer and analyze the survey data. We also have a webcast replay on the AHRQ SOPS website on best practices for administering the SOPS surveys from January 2024 that you can watch. Generally speaking, you should include providers and staff that have worked at your facility long enough and are familiar with the day-to-day activities and organizational culture in your facility. You can decide if you'd like to administer the survey to everyone in your facility or only to a sample of providers and staff in specific departments or staff positions. Then once you have your survey results, we encourage you to provide feedback by sharing the results throughout your facility. And you can also use the SOPS action planning tool and improvement resource list to assist with identifying those initiatives and to implement for improvement purposes.
Thank you. And another one for you. What is the process for data submission to the SOPS databases?
Sure, yeah, that wasn't something we covered today, but your organization would need to submit site level information such as the site name, address, point of contact, the survey that was actually used so we can validate that it meets our eligibility criteria, a signed data use agreement that protects the confidentiality of your data and states how we use that data, and your survey data file. We have data specifications posted online, but if you have any questions during the process, you can contact our database technical assistants by email at databases-on-safety-culture@westat.com. And also, we really do recommend that you send us your survey just so we can really review it and make sure that it meets our specifications and allows you to be eligible for the database.
Thank you. And Rose, you're suggesting sending the survey. I'm just going to follow up on that. If they're using the survey off the AHRQ website, do they need to send it to you or only if they're making changes?
We still need a survey if it came straight from the website because we just need to verify that that's the case.
Okay, thank you.
Mm-hmm.
All right, is there automated analysis software available to analyze the survey data?
So each SOPS survey and supplemental item set has an easy-to-use data entry and analysis tool that uses Microsoft Excel and macros to automatically calculate and display your facility scores in charts and graphs. Comparing your results to the latest database results, you'll just need to email databases on safetyculture@westat.com and you'll request the tool for your settings. So if it's hospital or you're looking for hospital workplace safety, just let us know that's what you're looking for.
Great. And that is free, right?
Yes, it is free. And unfortunately, it's not online. So you do have to reach us by email.
Okay, thank you.
Mm-hmm.
Is the SOPS Hospital 2.0 survey appropriate for state psychiatric hospital settings?
Yeah, so there are some psychiatric hospitals that administer the SOPS Hospital Survey 2.0. You might also consider adding the SOPS Hospital Workplace Safety items, which focus on workplace safety for providers and staff and focuses on burnout and addressing workplace aggression from patients or visitors among other areas.
All right. This question switches gears to community pharmacy and asks, are there any plans to repeat the community pharmacy survey benchmarks?
Unfortunately, not at this time. We don't have plans to repeat this database just due to the small number of submissions from pharmacies in the past.
Okay, thank you. We have a question from Mary Drotz. As of last year, the SOPS is to be administered every 2 years. When will this be yearly?
The SOPS surveys can be administered as frequently as your organization would like to administer them. However, it typically takes time to analyze and share those results, identify areas for improvement, and see culture change. The SOPS databases intake survey data every 2 years, but again, your organization can administer the surveys every year and just submit your most recent data to the database.
Okay, and I might have that might have been in response to the structural measures, patient safety structural measures. So the option there is if you're going to do it every 2 years, you'll need to meet those requirements. You'll they're saying to do it yearly or annually or some sort of pulse survey. Okay. Does it cost money to submit to the databases and be reviewed by your team?
Not at all. It is free, and we also provide the free technical assistance. So if you want to email us, call us with questions as you go through the database process, we're more than happy to help.
Great. And how is the survey generally administered? Online, paper?
You can administer the survey using any of those modes. Most hospitals administer the survey using web-based surveys, but most nursing homes use paper. There are some facilities that kind of use a mix of both. So it's try whatever works best for your facility is what I would recommend.
Okay. This question comes from Chelsea Fossey. Are there plans to develop SOP surveys for additional health services such as dentistry, dental offices, or dental clinics?
Not at this time, but we're always looking for suggestions and ways that we can improve our program.
Yeah, so if you have those suggestions, we got them right now, but if there's areas, please feel free to reach out to us. Send an email saying what the need is, and we'll bring that to AHRQ. All right, here's one from Carrie Day. Do you cover substance abuse treatment institutions?
Not specifically, but if it is an outpatient treatment facility, you can see if the SOPS medical office survey would be applicable in your setting.
All right, this next question, and thank you. This next question is from Zelma Breedeen. Is there help for facilities with collecting the data?
Not only the survey users guide, we don't typically administer the survey for facilities, but you could also reach out to us for a vendor list or look for vendors that might complete that for you.
Okay. I'm looking for some other questions. Give us a minute, but as we wait, go ahead and please feel free to submit your questions. I see another one here. Dr. Mohammed Baitia, when should we contact AHRQ to be part of the SOP survey for 2025?
So I'm going to say this is probably for medical office or ASC, but in general, you can reach out to us now or anytime that works for you. I would just say that we would only accept the survey that you use in the data use agreement, which you can email to databases on safetyculture@westat.com. And then in those timeframes where the database is open in June and September, you would log in online to submit the survey data, but you can reach out to us now if you'd like.
Okay, great. We probably have time for one more question. And I see one from Salima Merchant. Can you share strategies to improve the survey response rate and physician involvement? And I'll go ahead and take this one, give you a little bit of a break, Rose. Yeah, so you can also watch some of our webcasts and look at the user's guide. There's a lot of good hints in there. But I think one of the biggest takeaways we've seen is you really need leadership to promote the survey. So whether that be, leaders going around promoting the survey, doing it in staff meetings, having sort of competitions within your healthcare setting, who like a unit getting the best response rate gets a pizza party or something. But leadership support is key, and promoting it across the entire organization is also very important. And that, from our examples we've seen, that improves response rates dramatically. That's all I think we have time for today. So let's go ahead. If you want to find out more about what we're doing, we do periodically send email announcements notifying users about various SOPS happenings, such as webcasts like today's, data submission timelines, survey development activities. You can sign up for these email updates by going to the top right corner of the AHRQ website and choosing email updates, selecting surveys on patient safety culture, and you'll be on that list. Next slide. All right, I want to thank you again to our speakers and everyone attending today. A brief webcast evaluation will pop up when you close out from today's webcast. Please do take a moment to provide us with your feedback. It really does help us improve our offerings and plan future events. Thank you again for joining us today, and this concludes today's presentation.